one of the non-curable disease, Willliam Syndrome. Myself Sukumar, I am the student of occupational therapy. This Willem syndrome is one of the chromosomal abnormality. We have 46 chromosomes, we all know. So in this seventh chromosome has many more genetic materials. In seventh chromosome, some genetic materials are missed in the Willem syndrome. So this include protein elastin. So genetic material is needed for producing the protein. So protein elastin is lacked in the Willem syndrome persons. So the elastin protein product gives blood vessels the stretchiness and the strength along the lifetime. So this is missed in these persons. So the break in DNA maximum forms in the development of sperm or egg cell. So while the gamete is fertilized, Willem syndrome is formed. Okay, what happens when this Willem syndrome occurs? Most commonly, mental retardation, horn defects, and facial feature changes. So these are all occurs most commonly. Some other symptoms are shown in the children, like low birth weight, failure to gain weight appropriately. So the age appropriate weight is not gained by the children. And kidney abnormalities are also, and abnormal muscle tone is the passive tension maintained in the muscle. So abnormal muscle tone is present. Some persons also show some sensory issues, hypersensitivity to sound, hypersensitivity to loud noises. Some person may show overly outgoing personality also. How doctors diagnose? First by the symptoms they diagnose, and thereafter FISH, fluorescent in situ hybridization. So this is the next level to the karyotype. In karyotype we can see all the chromosomes. In this fluorescent in situ hybridization we can see the DNA material, gene materials in the chromosomes, by which the doctor can see the elastin protein and they can conclude is it a Williams syndrome or not. So what is the treatment? I already said there is no cure for Williams syndrome. So we can treat and monitor the person symptomatically. So we can reduce the symptom by giving treatment to the symptoms. They may need treatment for whole life. So because they have a DNA material lag for their whole life, so they need treatment forever. In 8,000 children, at least one children have this Williams syndrome. There are no real risk factors, but the parents having the Williams syndrome may have the chance to produce Williams syndrome children. Many more support groups are there for the Williams syndrome, like Williams Syndrome Association, Williams Syndrome Foundation, Berkshire Hill Music Academy. So like these groups are supporting the Williams Syndrome children. Some therapies like music therapy, riding therapy, special teaching and parenting info. So these are all the therapeutic areas. Once again we have to go through the problems. So what are the problems having the Williams syndrome? First, heart problems. So maximum stenosis occurs. Stenosis means narrowing. So blood vessels are narrowing in the person. So if the narrowing occurs, hypertension, high blood pressure may be produced, and hypercalcemia may occur. Kidney defect due to the stenosis of the renal artery. So stenosis occur. Stenosis means narrowing of the blood vessel. Some hernias, groin hernias, umbilical hernias are also the clinical features. In psychological area, the person may having the mental retardation, memory problem, and behavioral issues, learning problem, and a sensory problem. So these may also occur. Physically, they have a facial characteristic, facial abnormal features, and a growth problem, and a weight gaining problem, and voice problem, and a dental abnormalities. So these may also occur. So in our video, we are go through the what is Williams syndrome. In our further videos, we will discuss more about more conditions. Be proud to watch our video. Thanks for watching. Bye.